Hello everyone. Today I have brought with me two amazing doctors who have been working amazingly well, incessantly to help patients with endometriosis. So with me I have Dr. Vivek. Hi Dr. Vivek.
Hello, Chiba. How are you?
I'm doing well. And they operate out of a lot of hospitals. And this hospital where I'm sitting right now, Nalini Speciality Hospital in Goregaon, East Mumbai, is their place. And this is where maximum complicated surgeries happen. So, Dr. Vivek, we have been into this amazing workshop that you are doing. So, I wanted to ask you, why did you start this workshop, doing this workshop, and how do you think it's going to help patients with endometriosis as well as doctors?
So, thank you, Shilpa, for having us in this talk to speak about Nalini Speciality Hospital. It was our dream to have a surgical unit which is equipped to handle complicated cases and where multidisciplinary team approach and a comprehensive endometriosis care can be offered. So here we have two very equipped operation theaters with 3D cameras and higher end equipments to handle such complicated cases. So I have been involved in teaching. I have been practicing for the last 27 years and doing in deep endometriosis surgeries maybe last around 15 years. So been involved in teaching in various ways. So here we have a practice of deep endometriosis patients, and in our practice we come across patients who delay their surgery because of lack of funds, because at times these surgeries get expensive in big corporate hospitals. So we take some industry support, and we to gather the patients together, having a workshop in which we take consents for relaying their surgeries to only the doctors, the gynecologists who are wanting to get trained in deep endometriosis surgeries. So it helps us dual ways. Our patients waiting lists get over, their surgeries are done quicker at quite less charges if you compare the normal charges, and then we relay them live with active discussion. So as we know that deep endometriosis is a problem where it's a complex surgeries. Even trained excision surgeons is the need of the hour. What we are seeing today is a big boom of residual disease, which are not tackled primarily in the primary surgery. And it is going to get more and more complex. So any number of surgery, first surgery, if you compare, is better than going for a third surgery. I'm operating the patient third time, it is very complex. So residual disease should not be much. So we should have more trained surgeons in endometriosis. And if you do a very methodical approach, it is not a risky surgery if you get trained in it. So that's what we tell our trainee doctors and the gynecologists who wish to get trained. So this is the purpose. It's a dual purpose, helping the patients who need these surgeries and training the doctors for excision surgeries. So that is my contribution, or our hospital contribution towards the endometriosis awareness and help. Thank you.
That's so brilliant, Dr. Vivek. I think you're doing a very, very noble job. And like we said, the first surgery should be the best. So now let me take you to another amazing and talented doctor, Dr. Shinjini Pand. Hi, Dr. Shinjini.
Hi, Dr. Shilpa.
I wanted to ask you, first of all, how did you get into doing surgeries for endometriosis? And what is your take on recurrent endo? People are coming back to you. I saw your case today. It was like a really messy case. How do you feel when you see cases like that?
Shilpa, at the outset, I want to thank you actually for making this possible, for being a part of our team now. And having said that, so endometriosis has been a journey as a surgeon for me. It's a passion. it's not just about the surgery, but the first thing that you as a surgeon should realize that it's just not the surgery, the aftercare and the care that you offer a woman through her journey of life. Journey of life meaning at least from menarche to menopause. So that is what we should be concentrating at. And as a surgeon, you understand that the post-operative sequelae and how do you minimize the number of surgeries that she needs in her lifetime. That is what needs to be understood. So basically, it's multidimensional approach. You need to be very skillful as a surgeon because just as Dr. Vivek also spoke now, so it's said that the first surgery should ideally be the last surgery for that particular patient. But unfortunately, even in the best of hands, sometimes that is not possible. The disease has an intuitive, aggressive nature. And especially if we are doing conservative surgeries in younger patients, this is the group that sometimes goes to have recurrences. So it's not just the surgeon, it's the aftercare and the type of treatment and how you channel her through her journey, how you help her achieve her targets in life. For example, if it's about quality of life in terms of pain and performance, sexual life in terms of fertility aspects. So how you do that? So you need to be very skilled yourself. The approach to surgery is basically retroperitoneal, which in benign gynecology, unfortunately, is not taught to us, even if we are laparoscopy trained. So many centers don't, they teach you the basics of surgery, but the retroperitoneal approach, or for the general population, let's say the approach is like how we do for oncology. So this approach is not really taught. So that is why so many routine gynecologists who handle the patients, unfortunately, it leads to partially done surgeries leading to a lot of recurrence. So the training needs to be imparted to all colleagues who are interested in performing this surgery, which is a very, very important part of the whole thing. The second is there has to be a multidisciplinary approach. As you all know, pain is multidimensional. So you need to have a team of, let's say, the physiotherapist, the pain management anesthesia team. You need to have nutritionists. You need to have therapists. Okay? Because unless you tackle it on a whole, or unless you adopt the holistic approach, let's put it like that, you will not, just the surgery will not give the patient her 100% life worth back. So this was the ambition with which we started Nalini Speciality Hospital, myself and Dr. Vivek Salunke, to provide one center, one step care for women suffering from this disease. That was the first intention. So we have now, it's been 3 years for us. We have now grown in our team, and you are now a big part of it. And we have our anesthesia team, we have a very good therapist, we have pain management specialists, and we are now routinely, the patients get all these options available. Also, training is a big part of our intention here. And we have not just students, but even experienced doctors who come to us specifically to see the endosurgery. And it is for this purpose that we have live surgeries with permission relate across to the gynecologists. Last but not the least, the primary aim is to give the woman with endometriosis the understanding she deserves, the care she deserves, the surgery, the right way, or the radical surgery that she deserves, yet being conservative towards her function, so to say. So that has been about our team and my team.
That's wonderful. That's really wonderful. And being here at Nalini today and seeing the surgeries that they do, it actually is it's uncomparable. I mean, I was like shocked looking at the kind of cases that these doctors had here. And just to clarify, we want the patients to be more inclusive. We speak about women because mostly patients coming to the hospital for getting treated for endometriosis are women, though we understand it is present in others also. But as of now, unfortunately, there are only women who come here for treatment. But eventually, hopefully, when people start coming out, maybe the other genders also start coming in. That was all about Nalini Hospital, Dr. Vivek Salunke and Dr. Shinjini Pande, and it has been a beautiful experience. You have to see the surgeries to believe what they're doing. Thank you and take care.